Welcome back, everybody, to another episode of GCC Tech Talks from 70 Experts. It's me again, Tom, with my co-host, Sai. Today, we're having a conversation a little bit closer to our heart. So we have Leina Essakalli. I've butchered it wrong again. I've been practicing the last name and I've got it completely wrong. So we've got Leina on the podcast. So Leina has led large-scale AI transformations. Background in data science, but it's lovely to have you on the podcast, and thanks for joining us.
Thank you so much for having me. I really appreciate the invitation and looking forward for the conversation.
Amazing. I think we're gonna have to try and get my editors to fix how I pronounce your last name there, so I'm sorry. But what we'd like to start with is just a little bit of background about yourself. I know we had a conversation off camera. You've kind of traveled a lot, and we talked about Harvard, but would love to, give the audience a little bit of, who is Leina?
Sure. So I think I will introduce myself in the most personal way. I would like to first talk about my origins, and I think it explains a lot why I'm doing what I'm doing and what brought me here. So I'm Moroccan. That's how I describe myself. And I also have a very strong family value. For me, family is very important. And the person that inspired me the most in my life is my grandfather. So my grandfather is no longer with us, but he was the first Moroccan doctor that actually was allowed to practice medicine in Morocco.
Wow, that is a story.
Yeah, that's amazing.
Now I'm starting to piece you off.
Yeah, that's amazing. That's amazing. That's amazing. I'm so glad you brought that up.
Thank you.
Hats off to your grandpa. So.
Thank you. He has an amazing story. So he was in a French school during the time of the protectorate in Morocco. And he was against the protectorate, and he started raising his voice in a total pacific way and started in a French school to talk about it with his classmates, etc. Because of this, the school didn't want him as a student anymore, so he was excluded from school, and he didn't want to say that to his parents. He was 15 years old, and he was pretending that he was going to school every day, but he was going to the coffee shop in front of the school, and he decided that he wants to study his high school diploma, and he actually succeeded in having his high school diploma at the age of 16.
Wow.
And he got the best grades, very, very good grades. So at the time, the Sultan of Morocco, and now we have kings, but at the time it was a sultan, he welcomed him in the palace, and he offered him a scholarship to go and study in France. And out of respect, my grandpa asked him what he wanted to study, and the Sultan chose for him. He decided that it would be good if my grandpa could be a doctor, knowing that at the time Moroccans were not allowed to practice medicine because it was seen as a very noble job.
What a wonderful story!
Yeah, that's amazing. That's an amazing, and if you look at it, the inspiration that he gave you it's years on, isn't it? It's how many years has it been? It's been a long time, isn't it?
It's been a long time, and also my grandpa was not talking a lot. He was not promoting himself. For him, he was a doctor, and a doctor should never promote itself. Like the whole purpose and the duty of a doctor is to be here for his or her patients and not like promoting himself in any way. So for him, talking about himself is a form of promotion, even to his own family. He was extremely, extremely humble. I have a lot of story about him. So once we were in the street and someone came to him, and us as a family, we all used to call him like doctor. So I knew since I was very young that he was a physician. And someone stopped him in the street and said, "Oh, I just want to say thank you so much. You saved," I don't remember if it was like my mom or someone in this person's family life. And thank you so much for that. And my grandpa was like, "Oh, I'm so sorry. It's not me. I'm not a doctor." And then I was very confused. Like, what do you mean you're not a doctor? And he said, "I shouldn't be thanked for this. This is my duty. I shouldn't be given prize for this." So this inspired me a lot. I don't think it's very rare today to find doctors that have like such willingness to really give their life for their patients and for better good.
What did he specialize in, if you don't mind me asking?
In a pneumologist. He was a pneumologist, yeah.
Okay.
Yeah.
So you didn't follow the same way, did you?
So that's the thing. He said he had also a very strong value for work. And he said, like, my mom is a dentist, but he said, I don't want to close my practice until someone from my family takes back the keys. And he was hoping that person would be me. We were very close, and he said, "I could totally see you." And he was very smart. He was like 90 plus when I had this conversation with him, when I actually told him, "Listen, at school, I loved biology, etc. But I also like maths and physics. And I don't want to constrain myself to being a doctor and losing, this part a bit." And he was like, "So what do you want to do?" I was like, "I want to be a biomedical engineer." At the time, even myself, I was not very clear in what a biomedical engineer was. And then he didn't say anything. Again, he doesn't speak too much. And then 2-3 days later, I used to go and visit him every single day. He came to me and he said, "I think this is even better than being a doctor, because you are empowering doctors with the right tools to make the right decisions. And as a single person, you can only see a finite number of patients in your whole life because your time is limited. So I think the impact that you will make would be greater." So I kept that in mind. He always encouraged me to be myself, do whatever I wanted to do, and this is a great inspiration for me.
Wow!
Do you know, I've got goosebumps.
I know. I feel like
honestly, it's one of those stories where you really feel the story, don't you? And you tell it so well. Honestly, you tell it so well.
No,
Thank you.
And hats off to your grandpa. He sounds like a wonderful man.
Do you know what? I think he would be so proud as well. If he's looking down on us, he would be so proud today, definitely. So
how's that shape? You talked about how that shaped you.
Yeah.
And so did you go and study, okay, I'm going to go study biomedical science? What was the kind of the route, and did you have an end goal in mind of what you wanted to end up doing as a career?
So biomedical engineering was also because my dad wanted me to be an engineer. But for me, like my dad is an architect. My brother is a civil engineer. So for me, like, I hate buildings, and I don't really care about like the material that buildings are made of. And my whole family used to have conversation about bridges for like hours and hours. And I was like, I'm not interested in that. This is not what I want to do. But then I could actually understand that there is such a field that not a lot of people studied at the time in Morocco that combines like biology, etc., with how you can translate all of this into math. And I found that very, very interesting, how you can combine formulas with molecules and study really a very large number of subjects, because in our body. It's just incredible how our body is made, and how you can actually back all of this with physics and different types of physics, so solid, fluid. And you realize that when you do biomedical engineering, you actually study all types of engineering and all types of incredible subjects. So I really enjoyed it.
Do you know what it sounds like to me? You had to please a lot of people, didn't you?
So you had to get the engineering.
Yeah. Do you know what? You've done really well. Honestly, you've kind of captured every single aspect, I would say, definitely.
To be honest, I think there were, my mom wanted me to be a dentist. That was not even an option. My family is very artistic. My sister is a Moroccan dress designer. Nice. And they also wanted me to take art classes and all of this. I was really bad at this, and I told them, I don't want to do this. They made me play piano. I was like, I'm not good at this. I don't want to do this. So I needed, it's not that I needed, but I pleased a lot of people, but it was my choice. I was never imposed a choice. I was just giving, the cards and advice, and I'm really glad I got those.
That's nice. That's nice that it wasn't imposed upon you.
No.
Because in our culture, it's pretty much you're told what you're going to do, and you do everything you can to please everyone around you. So, you've done really, really well there to manage everyone as well, and the family as well.
So moving on a little bit then. So that you studied biomedical engineering, then kind of what was did you do a graduate scheme, or how did you kind of get into the career side of things? Yeah,
so I studied biomedical engineering at Imperial College in London. I loved my experience there. I went from a French to an English, UK school. It was very different, the transition. And then I decided that I wanted to go somewhere new. So where I didn't know anyone, I went to London with a lot of my best friends, and I was like, I just want to discover something. And also the pressure at Imperial was very high, harder than Harvard after. And I decided that I want to go somewhere, and I went to South Africa. I had the time of my life. I had an amazing experience. I did an internship at the University of Cape Town. I think it's definitely one of the most beautiful universities. You're literally in the middle of the mountains. The culture there was amazing. And I loved traveling alone. That's something that I think shaped me. In the fact that you're never actually alone. I'm a very sociable person, so I had a lot of strategy on how, I could make a lot of friends and not lose friends. So, for example, one story that I like saying is that once I was in a party in Cape Town, and I went with a group of friends that I made on the beach the day before, and then I lost them. And then I was like, okay, I need to make friends and not lose those friends. So I looked up and I was like, who's the tallest in this party? So then if I ever lose him, I can just put my heads up and find this person. And I actually made friends with him.
It's like the old arrow.
Yeah, you wouldn't find me.
The arrow that you put on your wife or your kid to find them.
Like an Apple Watch. How long were you in South Africa for?
So I was there for 6 months.
Okay. Well, shouts out to all the South Africans, because South Africa is such a beautiful country.
It is. It is amazing. The culture, the food, the people, the vibes, the activities that you do there.
The animals.
Yeah, the animals. It's just an amazing country. I loved it. I felt so alive there.
Wow. So South Africa for 6 months.
Then I went to Harvard.
Okay.
So I moved
were you studying at Harvard?
So at Harvard, I studied bioinformatics. What it means is the intersection between AI and biology and healthcare in general is how you can use data and algorithms to predict some types of diseases, and also how you can interpret different types of data. So combining genomic data and other types of signals that you have, biomarkers and others. It might make you...
That's all right. It's getting interesting.
We're also we're here to learn. I love it.
But yeah, it was very interesting. Obviously, Harvard. I also did some courses at MIT. It's just a concentration of brain and also creativity, entrepreneurship, and just brilliant people. It was a very, very good experience. I loved it.
Right.
Sounds like fun.
Yeah. Yeah, it's definitely not the type of job I'd be up to do, that's for sure. But, but good on you. And
yeah, Tom's not really a techie. Tom's
more on the commercial side.
But,
so then you went into kind of data science, right? So I guess that role kind of lends itself, right? You need maths, you need the smarts, you need to understand, obviously, biology and all of the genomes, that side of things. But I guess it gives you a space because you're always testing theories and predictions, right, and models.
Exactly. So you have a hypothesis, you start with a hypothesis, then you need to actually clean the data that you're given, and you need to test this hypothesis. So it is very scientific type of thinking. After this, I worked in a startup based in the Bay Area. This startup had a medical device, and this medical device was, it's not very sexy per se, but it was collecting urine during surgeries and post-surgeries, so during operations and post-op. And there was a sensor that was put inside the body, and we were collecting some signals from inside the body. And the idea was, again, hypothesis. Let's take the hypothesis, can this help us detect some types of diseases? So it was a hardware, a medical device, but we used those signals to develop a software, and we developed an algorithm that received the FDA breakthrough designation. So this was honestly one of the highlights of my career. I was really, really happy to be able to contribute to that.
That's fantastic. Do you know, I want to touch upon what role data plays. And I'm trying to kind of sense from you that FDA breakthrough. How important was the data? How important was the quality of the data? The quantity of the data? Those kind of things. And I want to touch upon, especially in biomedical sciences, I don't think everyone realizes that works in banking and insurance, and outside retail and places like that, how much data that you actually need to build an algorithm, how much data you actually need in order to kind of prove a theory. It's a long process. It's not just put the data in, clean it up, and then you can put it on a dashboard and you can believe the numbers. It's a very, very different space, shall we say? And I wanted to make sure that we touch upon that while we're talking about this. So what I would say, what is your viewpoint, and what's the crucial role that data plays, should we say?
I think this is a very good question, and I think the best way to illustrate that is to tell you about my experience in that particular role. I worked around 2 years on this project, and I think if I had to think proportionally, I probably spent 1 year and a half cleaning the data, and 6 months developing the algorithm, or even less than that. And this is very, very critical, especially at the time, because there were not a lot of, all those algorithms that now came out that help you do this work better. But it's still a very, very critical step that people are sometimes missing. And they're just building AI engines on things that, don't have the foundation. So this is very critical. And then, so you mentioned the quality of the data. So there was a specific process that we were following, and that took time, and that was very, very laborious. Because imagine you take data from different hospitals, and this is linking back to your question about the quantity. So in terms of, there are different types of algorithms, right? And to prove that this is working, it depends to whom you're proving, right? I think the level of, like, the bar is the highest when you talk to the FDA. We're talking about human lives. We're talking about actually taking decision instead of a doctor, or at least helping the doctor taking this decision. And this follows a very, very strict process. This same process then getting a drug approved, right? And this is very hard. And the way to convince them, actually, we had the first pushback because we didn't have enough patients. And then the other one is to be able to diversify the sources of patients. So basically, you cannot do that if you prove, even with like 10,000 of patients in one single hospital. You need to be able, and unfortunately in the US, here it's a bit different, but in the US, the way people store the data in what we call electrical medical records is completely different from a hospital to another.
Yeah.
And then if you're actually developing the algorithms, you have to compare apple to apples, right? So a very simple example, for example, if you look at the sex of the patient, right? It can be recorded in so many ways. It can be 0 and 1s. It can be female and male. It can be F and M. It can be sometimes FE and sometimes M. And you need to do this whole mapping. For male and female, it's quite easy and trivial. But you have other things where you start looking at actual signals and actual biomarkers, and those can be completely different in the way they are calculated. So you start entering a lot of math into that. It is a very critical step.
I think this applies to any data and AI project, right? We work with, so we actually manage, as part of 70 Experts, we manage a machine learning platform for one of the largest American pharmaceutical companies. So they've got about 6,000 users. We spend the majority of the time helping them stitch, clean, and get data ready for machine learning, for algorithms, for AI, whatever project. Because if you think, even if you're a retailer, they might be collecting data from customers, but the way it's input, it can be different between different stores. And then you want to go, okay, we're going to deploy AI across the business. How's the AI going to interpret what you mean by certain things unless it's clean, proper data dictionary? It's got a good semantic model in there. It becomes very difficult. And when you're talking about then data science, that's extrapolated.
I was going to describe it as, I think what you were describing was a common data model. That's what you were trying to achieve. And common data models are quite common across all industries. But I was trying to kind of point out the complexity. I think I've never done a biomedical science project myself. I've kind of been introduced to one. And I've looked at it and I thought to myself, this is very complicated, number one. Number two, it's going to take a long time. And number three, I don't feel I've got the expertise. I don't have the expertise in order to work on this project. Clean the data, coming up with a common data model, yes, possibly. But not going any further than that, shall we say. I think what I was trying to kind of get at is Leina is in a very specialist area. And a lot of data scientists in this area are like, as in the feedback that I have from them is it's not an easy world to work in. Let's just say that. It's not an easy world to work in, as in going from like, like the typical data science algorithms that you use for, say, I don't know, hyperparameterization or something like that. Going towards biomedical, it's a very niche area, should we say? That's what I was trying to get at.
Yeah, I think also, at least in that particular journey, I had to embark with me the physicians, the doctor, and try to, at the time, explain to them what is AI. And also there is this whole idea of change management and adoption, and how do you convince them? And the best way to convince them is to talk the same language, is to be able to answer their questions. And one thing I think that did the success of this project is that we brought on in the company the first doctor that actually trusted us. So that doctor was a very influential doctor in the US, etc. We brought her in, and she helped us. So I studied at Harvard. When I studied there, all my peers were actual physicians and doctors that were already working. So I am familiar with the vocabulary. I understand things, but I'm not a doctor. So this helped a lot to bring both knowledge into the company, but also build credibility outside and convince more people to come with us on board in this particular journey.
I think that's what I was trying to do. How do you chain it together?
Yeah, and I think you're in a nice position where you've studied in that sector,
yep.
So you're not necessarily a doctor, but you understand what doctors are trying to do for their patients, and you can take that back to a data and data science perspective. Yeah. So after that role, so this is startup world.
Yeah.
Then did you stay in startup world?
No. Actually, I moved to the UAE.
What year was this? Sorry.
I'm not good with years. That was...
Or how many years ago?
Okay, that was in 2023, I believe. 2023.
So about three years ago, roughly.
Yeah, more or less. And I moved to TII. TII is a government entity. It's like the R&D arm of the UAE, applied research. At the time, it was composed of 10 different research centers, each one specialized in things. So there was the AI research center, there was the aerospace, there was a lot of very high-tech quantum physics, and I was employed in the biotech research center. So there I was working on a very interesting project. So I don't know if you know that, but it is mind-blowing, honestly. When someone first told me, like, why don't you work in the UAE? I was like, the UAE? Like, why the UAE? And I've got the opportunity to understand that the UAE is one of the most advanced, if not the most advanced country in the world when it comes to genomics. They sequence almost all the the citizen of the UAE, so all the nationals, and it is completely amazing, like the work that have been done and the quality. And there are different ways to sequence people, but the way they did it is like the most expensive way and the better way to do it. And the project I was working on mainly was how you can add other layers of data. So you have the genomic. So that's basically what your mom and your dad gives you. And then you have the epigenomic, is how this is changing over time. You have slight modification in your genome. And that's based on your environment. And then you have also the microbiome. So that's the bacteria. You have different types of microbiome. You have saliva, you have gut microbiome, and others. And hormones, and of course, electrical medical records and others, and how you can combine this data that is very different data, and this is very hard to do, and translate that into predictions of future health state, but also what are the things you can do to avoid those. And this has been a great learning opportunity, because I was at this time already transitioning out a bit from the technical stuff. So I was actually coding and developing what we call bioinformatics pipelines that are very different than traditional data science, because you're handling different types of data. And I was transitioning into, how do we actually build partnerships? Because we were not doing all of this ourselves. We had to bring the best in the practice for each of those. And how do we then communicate this information in a way that will be fun, that will be engaging, that people can actually chat with their results. So now it seems a bit obvious, but like 2 years ago, having the idea of asking questions like, is it okay if I eat this? Can I do anything about this? Should I eat this instead of this? What is the best thing for me? How important is sleep for me? And getting answers in a way that is, reassuring and raising the right amount of awareness when it's needed. That was a good opportunity as well.
It sounds.
I want to have a go with it. So this is based on, if it was me, my personal data on my health, that I could go and ask questions of it. That's so fascinating.
It is. It's one of the questions that springs to mind straight away.
Yeah.
Is if you put it into perspective, something like this, just for one state in the US, we're gonna concentrate on one state in the US. How long do you think it would take to come up with something like this for just one state? I'm not talking about all the states of the whole of the.
What
just
do you
one
mean
state.
by one state?
Like, as in, if you look at the
Texas.
say Texas or California or something like that. Because if you look at here, the Emirati population is not that big compared to the actual population in the country, because we're predominantly expats here. So what I wanted to do is make the viewers aware of the complexity and the enormity of this.
I think as you scale it across, like you said before, working with hospitals in the States, you're getting data in loads of different formats, right? And I think, what the UAE does well, it sets the standard and the practices and the framework very early when it sets out on something. Like you said before, it's invested heavily, which probably makes your life a little bit easier when it comes to working with this data. I'm sure there are 1,000 challenges going through that project still.
Yeah.
You've just answered Leina's question.
What challenges did you have?
That's a very good answer. Honestly, I am impressed by the UAE and the vision of the UAE, and also the execution of things and how things are done. And like you said, it's also a question of fundings. Okay, the UAE is not asking their citizens to pay for it, and they are encouraging them to do it for the better good of the country. And working there, I realized how amazing is this country because of not only how much they invest, but also how much they care. They really care about their citizens and also expats, and their goal is to empower them with the tools that they need to increase their longevity, live better, longer, etc. I would say that here things are easier. You are open more doors when you have the right ideas and the right background to execute those ideas.
Did you come up with the idea for the project?
No,
or is this
no.
you brought on board to help support the project?
I was brought on board for that. I had an amazing boss that had those ideas, and it's a bit of, you feel like it's a bit off limits in the sense that you can always add things and make things more different and bigger and better. That was great. And think about, a lot of different partnerships with a lot of different companies and
Your grandfather would be so proud, honestly. Honestly, I think that we can say that for sure, definitely.
I hope so.
Anyway, let's carry on.
Yeah, so
let's carry on. What was the next stop?
So the next stop is where
Probably
I am
brings you to
currently.
today,
So I work at PureHealth. So PureHealth is today one of the largest healthcare company in the world, if we exclude the US. So they cover hospital, clinics, laboratories, insurance, pharmacies, distribution companies. It's around 60,000 people today. And it is the best playground ever to be able to implement AI at scale and across different prism or lenses, I would say. So for me, it was a great exposure to what insurance is and how insurance works with providers, and really having this 360 degree and view on things. And also being more on the, what does it bring to patient? How is this helping treating better patient and increasing, but also what is the value that we're getting out of this as a business, right? How are we quantifying this value, and how are we realizing this value? So all of those have also been great learning opportunities.
I'd love to dive in a little bit more. You don't need to go into specifics because I'm conscious it's your current employer, but how do you go think about new use cases and then building that and taking that as a business case back to the business to say, look, I think there's something here. A little bit. Any
I could see your eyes sparkling as soon as I mentioned business.
Yeah, I was going to say it sounds like a central department.
It's important.
I was going to say it sounds like a central department that kind of has access to a lot of data from different entities across PureHealth. I think I was going to ask, what exciting projects have you worked on so far, if you can share the details? I wouldn't go into too much detail, but what are the exciting projects that you've worked on so far, and what are we expecting to see in the future as well?
So I think I will feel more comfortable talking about this, and I will talk in general and what is happening in the industry. I don't want to go too deep into.
And we just want to give our listeners. There's so many people listening. Looking around, where are our listeners? So they are, like yourself, thinking about, okay, how do I deploy AI? Some have failed, some are successful. I'm thinking about data. But for you that you've been through this process, what could someone take away of, like, how do I start on a use case for AI?
Yeah, so I think the way we identified with the team what is worth working on is quite, I would say, simple. Not really simple, but we went and asked people, right? We went and asked people that are leading those entities, where is their pain point? Where are they losing money? Where are they wish they could generate more money, right? So at the end of the day, you start from a need. And usually when you look at it, you start thinking about what generates for me the most money. And also, where are my biggest losses? So it's quite simple. And I think the framework can be used in any industry, but it's really looking at not just the cherry on the cake, but building the cake first, and addressing big problems. Usually addressing big problems is the hardest thing, but it is the one where we actually are willing to put the effort to tackle. So to answer, sorry, I think I forgot your exact question. If you can just...
No, I think you've answered pretty much most of it anyway.
Yeah.
Do you then think about, so say you've gone to the business, you've identified a key problem, we're hemorrhaging money here, or there's a big opportunity that we need to capture in this part of the business. Do you then think about, okay, who are the people and the tools we've already got in place, or do you kind of work a framework and, that kind of, I guess, blue sky thinking around it and then go out to market for kind of tooling and people? Or do you try and leverage what you've already got internally first?
So once we identify that this is something we really want to go for, we actually built a proper case around it. And this confirms the idea. So we work a bit deeper, we create a business case around it, and we try to quantify all of this. And in this process, we're already thinking about how would we solve the problem without looking at the market first. The reason being, in the market, there is a lot of things, but you're not sure that whatever it is out there is actually fitting your actual need. So we start with the why, and then we move into the how. And I think this is key, and this is where a lot of people are failing, because they are attracting by some keywords that some vendors or trying to spread. But really, let's start from what you need and what you're trying to achieve in terms of KPIs. I think this is key. And then we have two roads, and we have a great team in-house that is able to develop things and execute those ideas. And we're also looking out there in the market. We're looking at the best in the class. We have a process to be able to select the right partners for us. And it's really a question of who's the best one, and to be able to test who's the best one. We, of course, have a lot of data, but we are not allowed to use the data the way we want. We have very, very strict policies, both internally, and we follow very strict regulation. But we are, testing the best way possible on first synthetic data that is somehow similar to the data that we have, and then once we of course we have NDAs starting from the very very beginning, and we have ways to protect our data. We have a huge cybersecurity team. All of this is critical for us. But yeah, we are able to compare. So we put the same information in, and we see what is the information out, and we know what we expect as information out. I'm trying to simplify things here. And you can see how different solutions are addressing the same problem, and is it what you're looking for. And of course, today, the reality is that the models are getting better and better and better every day. So you are also looking at who are the people behind it. Do they really understand the problem? Are they in the field for a long time? What is their track record? And also, sometimes you need to think about what is the real impact that this solution have made in other environments. So you look at what has been done in the US, for example. And also another point is sometimes you don't need AI. How people are doing it without AI. Do you actually need to invest in AI, or is it just an automation play here? Or is it just something that really the investment is not worth the returns?
You stole my next question. Which was on how much is it AI versus automation?
Can I ask just one question in between that? So you mentioned about the synthetic data. Are you not allowed then under the regulations to create synthetic data off the back of the data you do have?
We are restricted, and also we restrict ourselves in how we share and data. This is all very regulated. And to be fully transparent, this is not my personal responsibility. There is a team that is handling this. We just give our thinking of how we want to do things, and they also advise us on what is okay to do, what is not okay. There are certain regulations. For example, we know that we cannot run things in the cloud in most of the cases, and then if it's cloud, it needs an approval from the DOH, Department of Health, etc. But all of those things were a bit. It is very, very important because without regulations, things can get really, really bad, and we don't want to go there.
Complicated is the word I would use.
It's not complicated. It is a big, big failure. It would be a disaster And at the end of the day, you have to remember why you're doing all of this, right? For me, I'm doing it for the greater good, and if I expose data, this is really bad.
Absolutely. I think we're almost up on time. Probably a couple more questions that I'd like to ask. One is, in the next, I guess, 12 to 18 months, what should businesses and business leaders expect or be sort of prepared for in the region? You know, coming from maybe an AI perspective yourself, is it?
I might be biased here, but I think in this country, there is a lot of interest in AI, and people are willing to adopt AI. So I see the difference. Of course, time has proven certain things, but I clearly see the difference between talking with the doctor that was in the US versus a doctor here. And I think adoption of tools and investment in those tools and understanding how this can actually augment you as a human and make you like superhuman is definitely key, because you might lose the wave. And I think this is a bit the right time of doing it as well, because you sometimes you want to have the first mover advantage, but at the same time it can be very risky because the technology is not ready for it, because it is now there is still a question with all those agents, etc., on the real return on investment. But it's not all about LLMs and chats, and there are other things. And I think what is key is really, again, think about what is painful. And what we mean by painful is not maybe always just spending 1 hour on this. Well, AI can help you out, because this might be the cherry on top that I was mentioning earlier, and not really the essence of what would make your business times true business in 2 years versus what will make your business completely lost all their customer, etc.
Yeah, there's a lot of trust in this country, and I think a lot of companies don't like to be the first here to try something. But there is obviously a benefit sometimes of being the first, because you kind of can potentially get ahead of the market. The other question I had: what are your top 3 favorite tools?
Tools.
Yeah.
This is changing with time, and honestly, I should keep up with what is happening in AI more, because the reality is, I think, if you have a full-time job, it's very hard to keep up on what is happening and what is available to you. I like Claude. That's definitely my top one. I've been playing a bit with Cursor lately for doing some vibe coding, etc. And then I would be very boring, and I would say ChatGPT. Reason being, it has been the first one in our life, and honestly, for me, maybe no one will remember ChatGPT like we don't remember MSN, I think it was called. But for me, like, people 4 or 5 years ago, when I said when I used to say I'm doing AI, they thought I was doing robots, like literally. Now people actually understand what is AI, what is data, etc.
Like, Leina, why didn't you tell us about this before? Like, I tried.
Exactly. So I think OpenAI has done an amazing job in terms of wrapping what a small part of AI actually is into a product that everyone can use. And they did an amazing job there. So big respect for their team and their vision.
Brilliant.
I think everyone's favorite and everyone's number one is Claude.
Yeah.
Right at now, the moment, anyway. Yeah, I think it's definitely jumped to number one. I use
so
Claude.
much time. Yeah, it saves so much time. It's unbelievable how many hours you actually get back from that one tool.
Yeah.
And they've done an amazing job. absolutely. Month by month, I look and I think, you can do this now,
Yeah.
you can do this now. And the rate of change is phenomenal at the moment.
It is. It is.
But even the data platforms with their vibe coding that they've introduced, whether it's Snowflake, Databricks, all of these, it's moving so quickly.
It is.
You can build apps. You can go, within an hour, you can build a full blown app doing something. It's incredible.
Yeah. Sometimes I want to take like 1 month off and just become a student again. My dream is actually to become a student again.
PhD?
Maybe you should open an AI teaching school.
Yeah, maybe.
A lot of people told me that actually.
Excellent. Well, thank you so much for coming on. It's been an absolute pleasure. I really enjoyed that.
Thank you. Thank you so much for having me. It's actually my first podcast ever.
Hopefully not your last now.
Thank you. Thank you so much for having me.
It's been an absolute pleasure, honestly. It's been a very, very interesting conversation. I've learned a lot. In the last hour.
I feel like if I'm going to become a granddad, I've got a lot to go and live up to now after this conversation. Excellent. Well, thanks so much.
Thank you. Thank you so much for having me. Thank you.
Thanks, Si. No pleasure. Thanks so much.
Thank you.
Yeah.
I really appreciate
that was really, really good.
Thank you.
Really good.
Thank you so much.
Really good.
Thank you.
Should we get a quick picture?